Welcome to my channel again. This is Zandra. Today I want to discuss briefly the development of the Maraca Health Shack in Chilede and Aluda, that's Trinidad and Tobago. It is a rehabilitative service that will provide support and guidance holistically to people who have suffered some neurological damage as a result of a severe cerebral vascular accident, injury through motor cars accidents, or ill health generally. It is also a unit that will provide nutritional and well-being advice for individuals who wish to change their model of living to have a more holistic approach to life. It will also offer people the opportunity to work with themselves, the inner self, to maximize that person within that got lost as a result of a neurological incident. So I'm also hoping that we would be working with the government agencies and others who may be interested in seeing such a unit in Trinidad. And it's based on the model of the Huddersfield Health Shack, which is in the United Kingdom. The reason for this model arose as a result of my own CVA, which had no known basis for it. I did not have any of the indicative medical conditions that would lead to one. I believe, from my own experience, that it was as a result of extreme stress. And because of this, and because I have traveled around Trinidad and seen people who have experienced what I went through, sitting and have a life in wheelchairs, that is not acceptable in this day and age. It is not acceptable that we do not provide rehabilitation at a level that's possible, and it is not particularly expensive to do so. Some of us, like I, was able to go back to the United Kingdom, where I live as well, to do my rehabilitation, but many people here cannot do that. Many people cannot afford a private physio like I did. Many people cannot afford to go to swimming pools like I did for rehabilitative work. I believe that the opportunity should be available to everyone that experiences what I went through and what they experience as a result of a chronic health problem. I do not have chronic health problems. My rehabilitation, and I travel on my own. I do things that help others understand that don't limit yourself because you have had an incident like mine, because it is possible to recover quite fully. So the Maraca Health Shack would be an organization, it is a registered organization, non-profit organization, to work with different agencies as well as individuals who share our common interest. It is intended to work on rehabilitation generally, well-being, health, nutrition, offering things like reflexology, aromatherapy, because I am a aromatherapist, I am a reflexologist, I am a stress consultant, and I'm a lot of other things. But I will not be doing the things like that. I will be training others to do it, because I think others need to learn how to help the community at a larger scale. We will be hoping to have 2 paid part-time employees, a manager of the center, and an administrator who will do all the fundraising and in the administrative support that the center might require. The center would hopefully work predominantly with people referred to us by the ministry and health service, but also work with individuals who wish to have a private experience with rehabilitation, and those who could afford it. Because in Trinidad, there is the big divide between the ones who could afford and the ones who cannot afford. I want to see this establishment, this non-profit organization, service the ones who are least capable of paying for a service. Those who can pay for a service could become members of the organization and pay a subscription and to use the service. I've looked at buildings around Trinidad that could probably be remodeled to suit the needs of this organization. And it is my intention and the board of the organization to seek discussions with the relevant parties to acquire such buildings, to refurbish them to the level of accessibility for people to use the service at a maximum. So the idea of sharing with you this model would be to ask if you're out there, and there are lots of Trinidadians out of Trinidad and Tobago who may have relatives who have suffered similar incidents and who are marooned to a wheelchair. A wheelchair shouldn't be somebody's lives. People should be able to maximize what they used to be and how they feel, and reach within to be the best version of themselves, even if they have some limitations of physicality. They should not be limited to a life of dependency on others. I live on my own. I care for myself. I travel on my own, and I do lots of things. Many friends have said to me, my level of recovery is such that no one would think I went through such an incident. Even my own attorney says, you do not look it, you don't sound it, you are I'm functioning at a level as most people can, or should be able to. So the idea of the Health Shack would be to bring about a shift in one's ability, physical, emotional, spiritual, to function holistically and at the maximum level within the social group. Funding will require us to raise funds through fundraising exercises, donations from organizations, and whoever is interested in supporting such a unit. We hope that the extension of one shack, I would like to see 5 shacks, all 4 across Trinidad and 1 in Tobago. I would also like to see the other Caribbean governments developing the same model for people in their islands. I recently visited Barbados, and they have the same problems. But I don't know what the governments of the Caribbean governments are doing towards offering a holistic rehabilitative service to individuals who have suffered a cerebral incident or an injury that requires their rehabilitation when they cannot afford it. It should not be the haves and the have-nots. Trinidad is very much the haves and the have-nots. If you do not have, you cannot pay for a service. If you have, you can, and then that becomes the dominant client. My wish, my dream, is that the government begins to address this at a much wider scale, and to help others, to help people, their citizenry, to maximize their lives while we are able to maximize our lives. So today, I'm hoping that the support we get from the governments as well as yourself will help us develop a website, will help us acquire a building, help us shift the thinking, the mindset that following a CVA or stroke, you're designed for a wheelchair. We also want to do the shifting of a mentality that we can continue to contribute to society even following such an incident. The locations that we want to look at is on the Eastern Corridor in Trinidad, where many people could access it, and the South Trinidad, where it becomes more accessible. In Tobago, where it is, again, centrally available to people. We have high incidence of blood pressures, diabetes, conditions that leads to CVAs and strokes, that leads to blindness and all these sort of incidences, and leads to amputations and leads to wheelchairs. This could be corrected by a basic intrinsic awareness of nutrition, good nutrition, healthy nutrition, and natural health and well-being. So, given the level of need in Trinidad, and I believe the Caribbean, I would hope that you would see this as a reasonable and essential opportunity to contribute. We are about to establish a bank account, and in the future, I will be putting that information on the system so you could contribute directly to the organization, and hopefully the board members would share with you individually in further videos what they see and how they see this Maraca Health Shack developing. I thank you for listening today, and I wish you well. I ask the Great Spirit to guide us as we seek this opportunity and as we journey towards helping others recover and maximize their recovery in a situation that sometimes is out of our own control. I thank you, and on Thursday I will get back to talking about well-being and spirituality and recovery following such incidents. I wish you well. If you are interested in what I have shared today, please suggest or contribute any ideas or comment on what I have said. I am looking forward to working with a number of people who could help us develop it from a marketing point of view as well as a status point of view. I am looking at how we would use lifestyle as a model for us to ensure that people who have had such incidences occurring to them maximize what is around them and what's available. We will also be giving advice to individuals of how they can work with their relatives and relations to maximize their health and well-being immediately after such an incident. From my experience, things are too late, because when we've had such an incident like a stroke, rehabilitation starts within the next 8 hours. To delay rehabilitation, movement must start within 8 hours. To limit it to 26 weeks, 7 weeks, in Trinidad, it was weeks before I saw a physio, would have seen a physio if I hadn't been able to afford one. So I want to shift the mentality about how we treat people following the events of a stroke. I want to see that we are positively active and actively encouraging people to start rehabilitation at the earliest possible opportunity. The machines I would be using would be aiming to achieve are called shape masters. They do movements we all need to achieve the maximum to be able to function daily. And if you're interested, please communicate with me through the email on this channel or make comments on the channel. I thank you again and welcome you to the idea of the Maraca Health Shack. And I'm asking you to support a very worthwhile activity that we are aiming to achieve here. Thank you very much, and I'll speak with you again soon. Bye-bye.